Good evening. I'm Dr. Kondekar. Sorry for the delay of 5 minutes to start today's Facebook Live. We're trying to discuss something about social approach in children with autism. I request all of you have any questions, you can keep on putting in the text box or the chat box below. And to ask any questions. I expect parents of autism kids to attend the session to understand exactly what kind of speech issues we face, socialization issues we face in the autism kids. Please let me know if you have any questions regarding the same thing. And I hope I am audible. If you are not able to listen to me, please let me know in details. We'll be starting the session in just 2-3 more minutes. As we all know, autism is a disorder of social communication, to which we have issues related to behavioral, repetitiveness, restricted interest get added. The social communication in autism is persistently and significantly lacking. For the same reason, they do have issues related to mixing up with the people, mixing up with the family members, mixing with the society, mixing with other friends and peers, and all these issues affect the social approach in children with autism. Am I audible? Anybody can see me easily? If any issues, just let me know. Mr. Dubey and Mala Murthy, if you have any questions, you can anytime ask me, because unless someone is understanding something, there will be some point in giving detailed information. So exactly what happens in autism is the child is not able to connect to the others, child is not able to connect to other family members, child is not able to connect to the society, child is not able to connect to living world, and child is also not able to connect to the non-living world also effectively. So what does this mean? That the child with symptoms of autism is not able to sense the environment, he is not able to be aware of the environment. As the awareness of the environment is lacking, child is not getting any sense about the issues around him, not getting any sense about the people around him, not getting any adequate and appropriate understanding of the surrounding, or adequate and appropriate understanding of the people or objects around him, and that puts the child in a state of sensory confusion. Now exactly what is this happening and why is this happening has a basis from the brain and not from the gut, not from the toxins, not from the fungus. We really need to understand that there is something which is happening in the brain, which is primarily happening, which is stopping the child, or which is preventing the child from developing cognition about his environment, from developing understanding about his environment, from developing awareness about his environment. And all this is happening. And all this is happening because the child's sensory system is not able to sense the social awareness. Social behavior has a significant effect in day-to-day lifestyle of everyone, including parents and the child. And that's why it's very important to understand that why the child is not able to understand the social and surroundings and the environment to make a cognition out of it, and how the child is not developing it. For the same reason, we really need to develop the understanding of what is a normal social approach in human development. In simple reasons, we really need to know that how a child or infant or a small baby does develop social recognition. Earliest social evidence of social recognition in human beings is by eye contact with the mother. eye contact with the family members, eye contact with the parents. Sometimes even before the eye contact develops, child starts looking at the mother attentively even while during breastfeeding. That is a social connect a child develops. We end up calling it as a bonding with the mother, and that is mainly because the child's brain is already set to learn many things based on child's genetic potential, capacity of the brain, and the environment to which child is exposed to. So immediately after birth, as the child is exposed to an environment where there is a mother, there is a caretaker, there is a human person who is giving sympathy, who is giving affection to the child, who is giving care to the child, and child's brain tries to understand this bonding, care, sympathy, affection from the mother to the child or the caretaker to the child through various senses. And all these various senses, apart from touch, smell, temperature, taste, hearing, vision, there are many different senses which are taking part into the child's integrated development. Ultimately, how does brain develop? His own evolution of the different milestones or understanding of the objects is decided upon how the brain interprets the senses which is achieving from the surroundings or from the different body parts. Now the sensory fibers which are taking the signals from different body parts, from the surroundings, from people around, are interpreted by the child's brain, and brain starts developing a background of understanding based on the senses. So when a newborn is fed by the mother's smell of the milk, mother's touch, warmth of the mother. Apart from that, the senses related to hunger, thirst, care by the mother, senses given by the mother to the child in the form of eye contact and communication are all perceived by the normal newborn as a collective sense while interpreting the senses. Now, when we are interpreting the senses, the sensory integrated areas in the brain, like say Wernicke's area or other fibers in the brain, which connects the different sensory centers, they are all developing their maturation. They are getting matured to develop some specific communication between the senses to make a meaning of that thing. So that by the age of 4 weeks, a child is able to even look or give attention to a person who is moving around in the house. Child at the age of 6 weeks is able to usually give eye contact and a social smile. A child at the age of 6 months is usually able to give a very sustained eye contact and response to the surroundings. Similarly, a child at the age of 8-9 months is easily able to point at the objects and demand something by showing the hands. And only when such proper development of the non-verbal communication sets in, a child is ready for developing a social approach. When the child is ready for developing the social approach, the first thing he learns is recognizing self and the others. And that's how the child starts developing the stranger anxiety. And when the child develops stranger anxiety over a period of 3 to 4 months, and after the next step, around the same time, the child starts understanding other ways of communication, that is by vocalization. So considering this, all are the stages of social approach of a human child in the first year of life. In autism kids, all these things may be perceived as normal to some extent. In many of the kids, those who approach with the regression after the age of 15 to 18 months, they present with the regression of the social milestones after the age of 15 to 18 months. So social approach in autism may be either not developed adequately, or not developed at all, or developed and regressed after the age of 15 months. Now, to really understand how the social approach, which parents claim that it was there before the age of 15 months, and in autism it is suddenly lost over a period of next few months, and then it is not regained easily. This kind of loss of social approach is explained by the hypothesis of synaptic pruning. We really need to understand that till the age of first 2 years in life, every second there is a development of 700 connections between the neurons, naturally as a part of learning from the environment. And now, since the environmental stimulus is not enough, or the brain's capacity is not enough to understand, or there is some reason by which the sensory dissociation occurs into the autism brains, or there is some loss of connections, or the speed of the processing of the sensory signals by the autism brain is affected, which is a one-time permanent insult. And due to this, the child is not able to understand the senses, but whatever signals he had already received to make chemical connections into the brain, these chemical signals and network, they tend to dry off, and they develop something in medical terminology called retrograde degeneration of the neuronal connections from the synapses. And due to this retrograde degeneration, primarily because of no use of these connections, or reduced input for that connections, or reduced forming of the synapses, the child appears to undergo a regression of the social milestones. And that's how autism kid may present anytime up to 6 years of age, with not achievement of the social milestones, or regression from the social milestones, not achievement of any communication, or regression from the communication. So as we are today discussing about the social approach in the autism kids, we really need to understand that how do parents behave, how do parents interact with the autism kids, and how do parents help develop a social approach in an autism child. Now it's very easily perceived and understood that when something is not happening, we try to make it happen by increasing the frequency of the inputs. And that is what is the principle of most of the occupational therapy and sensory integration in improving the social connect, is by increasing the inputs. So normally, if a normal child or normal human child usually learns things very fast by watching it 6 to 8 times also, in case of autism kids, these kids will have definitely significant deficit in performing, significant deficit in understanding the social recognition, social affect, social bonding, the eye contact or communication, despite struggling for even 80 to 90,000 times. With occupational therapy, sensory integration, and some degree of ABA, these children may be able to understand or learn the same things from 80,000 times to 88,000 times, depending upon the strength of the input given. Now this input is decided by the stimulus which you are giving for the sensory integration. Different types of senses will require different stimulus, and that's why your therapist maybe end up giving up you a specific sensory diet chart to be practiced ideally almost 10 to 20 hours in a week, which practically sounds impossible for most of the parents into Indian scenario. And that's how most of the kids who have autism label and are not able to go for these many hours of therapy, probably they may not develop a significant change. Now, only when the input is raised, we are finding some response and we end up giving that. It's as if a child who's going to fail in some exam, you put him some extra tuitions as a form of input, and you are helping the child to develop betterment in that case. But in autism kids, it's not always the input that is at fault, but often there will be an issue related to processing of the senses, understanding of the senses, interpretation of the senses, and also action events related to the senses as a response to it, which may be termed as a motor apraxia of communication or motor apraxia of the speech, which may be just a part of it. Don't try to get carried away by different means. We should just try to understand the social effect in the autism kids is by three things. One is input, second is processing, and third is output. So in autism kids, all three may be affected, or any one may be affected, and then that's why the child manifests with significant deficit in social affect. So parents and therapists end up doing their job to their utmost possibility by giving significant sensory inputs to the child as much as they can. A therapist will definitely do many times better than a parent will be able to give sensory stimulus or sensory integration or maybe sensory inputs to the child, so that the child will be able to learn little better in a systematic way. But giving only inputs, or maybe giving only input overload, may not be always the perfect response in the autism child with the same thing. So for the same reason, we find that many autism kids who are, despite having received therapy for 2 years, 3 years, 4 years, are showing only marginal differences in inputs in the form of outputs, because they may be having issues related to processing or integration of the senses or to the action. Again, there will be significant therapy techniques which your therapist will be definitely be aware of in improving the sensory processing by giving inputs in different variations in the form of the patterns, textures, consistencies, to make the child understand the sense in a little different way, so that there will be significant increase in the synapses, reorientation of the synapses, rewriting of the synapses, to make the child understand something in a repetitive way. Now, the social approach of the child is not just only from the connections, because if the connections are not perfectly developed into the brain, the child's social approach will remain undeveloped. And neuronal plasticity is something called as a flexibility of the brain tissue, which helps make the brain understand something depending upon the input. The earliest a parent realizes, the earliest a therapist realizes what is the problem with the child, and earliest we start the intervention, lesser time will be spent in doing the same thing, or maybe uh, it will be much easier compared to starting it at late. It doesn't mean that starting therapies late is going to not benefit your child. The synapses and the myelinations to a great extent can remain for decades, even though the speed of their growth gets reduced, and that's how the number of synapses appears to be getting reduced over the periods of the decades. But that doesn't stop the responses to the therapy, because the responses of the sensory development or the responses of the cognitive developments are always dependent upon the input, processing, and the output. Now, how to deal with a child who is having no eye contact? How to deal with a child who is having no response to commands? How to deal with a child who is having processing issues? And how to deal with a child who is not giving a single communication or any response to any sort of behavior? The reason is not only building up of the inputs to a higher level so that the child will understand, but apart from that, we really need to give a change in the environment of the child. Now, we need to understand that in autism, when the child is not getting connected to the living beings, we always see them getting isolated into the objects, and these objects become a object of fascination for these children, and these children definitely will try to only play with the objects, putting them in line, putting them in circles, putting them in queues, and then just be stagnant with it, because they do not understand what next to be done, just because they are not getting into social involvement with the family members. So first way to get a child get into a social approach is disregard the child's non-living obsessions. So any other break the child's non-living obsessions. So if a child is obsessed with anything, or any object, or any specific thing which the child will be continuously playing with in a specific repetitive manner, it's not actual an OCD. It's the compulsion for the child because of poor cognition and poor integration of the senses, that he cannot do anything beyond that. So to make the child break into obsession, you have to have few principles to manage such obsessions. If it is a milder obsession, you can just escape by doing a neglect towards it. If it is significantly affecting the attention and the responses to the parents, definitely we really need to break that obsession by making those obsessing things disappear from his eyesight. It's not that difficult. On a single night, you may be able to pick up all these obsessing toys in the house and just make them disappear for a few months. And definitely, child does not have that much of understanding to ask for that object by the name of it. But definitely, when he sees the similar object next time, he will definitely try to get into it. So for the same reason, we really need to divert that obsession into creativity, so that the child will learn something from it. Simplest way of converting any obsession to creativity, that whatever is the object the child is obsessed with, try to show him sketches of that object, try to help him draw sketches of that object, try to help him color sketches of the objects on a specific book, so that in the different format the obsession is getting converted into a sketches related thing, so that the child will also start developing the fine motor functions along with. Now, when you kill the obsessions with the child, you have to provide a stimulus to the child, which will be a living being in the family, a parent or a caretaker who should be continuously giving a social stimulus to the child. For the same, it is not that autism kids are deaf. They are not deaf, they are hearing, and that's why we need to give auditory stimulus to the child. Why not a visual stimulus to the child? Because 95% of the learning is otherwise also happening visually. And if you give only a visual stimulus to the child will not be able to use his auditory or hearing apparatus. And if the child does not learn to or does not hear the speech, he will be having much more difficulties into communication in the form of language. The same way, the child who is a continuous auditory learner, the continuous visual learner, the auditory learner will get suppressed and child will not be able to develop any auditory communication. For the same reason, I introduced the new concept of running commentary in day-to-day practice. So even if the child is not interacting with you, child is not looking at you, child is not responding to your talk or commands, whatever the child is doing or whatever you are doing, you have to keep on doing a running commentary of the event, whatever is happening. Suppose the child is playing with a car next to you, you have to keep on talking to him or talking around him, saying that okay, this child is playing with the car, he doesn't know how to play the car, or maybe he knows how to play the car. This is a blue car and this car is running very fast, but I know he should not be playing with it because he is a smart boy, he can do something. What is that? Do not worry about what the child is going to understand, but what we are doing by this is we are giving auditory bombardment to the child. When you are giving auditory bombardment of the child, ultimately what you are doing with the therapy, occupational therapy, you are giving the sensory bombardment to the child, where the auditory bombardment is not that heavily happening. And auditory bombardment is also done by the speech therapist, but again, it's only during that hour. So it's the job of the parents to give continuous running commentary of each and every event when the child is around, so that you are continuously exposing the child to auditory stimulus, hearing stimulus, which will help child learn something in the same principle of creating much and more auditory synapses from the inner hair cells to outer hair cells to vestibular nerve and the cochlear nerve. And this auditory synapses will help the child improve with the speech therapy and with working as a passive speech therapy, apart from whatever other techniques your speech therapist may be talking about. So these are the two ways by which we will try to connect with the form of the increasing the auditory stimulus. But often this may also not be enough, because we really need to show, touch, make the child feel, make the child smell, make the child taste, and understand all the senses. So what senses we are missing in dealing with that? Maybe sometimes the sense of breathing, sense of heartbeat, sense of gut and digestion, sense of air moving in the surroundings. So any of the senses, there are limitations to give how much overload can be given, and since if it is not directed, the child will get into a sensory chaos, and that is the reason we may not always get a successful response in most of the kids who have been treated with only one form of therapy or only form of say ABA or only form of sensory integration, but they may require speech therapy, occupational therapy, and all other techniques to be given together depending upon what kind of need, and that is not easy to assess even for the therapist. Forget about the parents. Really speaking, those parents who feel that okay, I can do this kind of therapy at home, please don't try to do that. Always take an expert's opinion and take a home program from your doctor, because whenever you are trying to teach any social affect or social communication to the child, you may try to do something, but you will never know definitely what is the next step which your therapist or the specialist will know. So it's very important, even if you're doing a home program, you need to go for at least 1 monthly consultation with your therapist to understand what is the next step as this program is not working, or what is the next step as this child is only labeling or doing this the way, or what are the different things which we can try at home. So it's very, very important that we need to understand the development of the sensory responses by the child during the processes of the sensory integration with various therapies. Giving various sensory stimuli without understanding how the sensory stimuli develop or bring about the sensory changes will definitely not be wiser, because without knowing, it is definitely going to be waste. Now coming to improving the processing speed of the sensory nerves, improving the communication between the sensory centers, improving the sensory integration occurring within the brain. What we discuss in forming social connect is social approach of the child and social behavior of the parents and how the sensory integration may be helping them out. But unless we make the socialization of the neurons inside the brain of the child, a child will not be able to socialize with the people around. Now, this concept sounds really difficult. How a neuron will socialize with the other neuron? It's only by forming a connection. How do we socialize with each other? We are forming a connection. There are 6 people maybe around here, and what we are doing is we are actually forming a connection. So whenever we connect, we get socialized. So same thing happening in the brain also, that the sensory system which is taking signals from the different sensory parts of the body, motor system which is giving different types of actions to the different parts of the body, and the processing system like that Wernicke's area or the reticular formation. These processing systems are connecting between the sensory systems, connecting between the sensory system to motor system, and connecting between the motor systems. These connections really need to be developed. So only when one node talks to each other in a chemical way, electrical way, or biochemical way, or mechanical way, these signals are getting transmitted from one node to another, so that these signals get amplified and they reach to the area of the as processing faster, and depend upon that the signals will be interpreted to a significant positive way, so that the signals can give a connection, signals can give a action, signals can give an instruction to the action area, so that the child will be able to do an appropriate action. Now, what kind of signals will come for the what kind of action will be totally decided depend upon the how often we are giving the signals, how often we are making these connections, and how we are developing conditioning for different responses with the different outputs. And that is all matters in these cases, so that we will be able to develop further understanding of the situation. And now, the different areas of the social communication, apart from the eye contact, apart from the listening, apart from the obeying commands, is also in the form of expressive communication, in the form of non-verbal communication, which is also a part of facial expressions, showing emotions, or maybe imitations. So all these things form a important component of the core symptoms of the autism. So what exactly do they have is a issue with initiating social communication. So initiation of social communication is primarily dealt with understanding a person who is communicating with us. We all should be knowing, or we all know, that communication is not a one-way process. We require two living beings to communicate. So when two living beings want to communicate to each other, even a single person is not interested in the communication cannot occur. For the same reason, to have a communication between the two living beings, a connecting environment has to occur, a connecting bonding has to occur, and the earliest way of showing that I am interested in your communication will be giving an eye contact. And that's how eye contact becomes the prime or the earliest feature which will suggest that okay, the child is communicating with or not, or child is ready for social communication or not. And how will the eye contact develop? Only when the child is aware that some person is there to communicate. So awareness of a social person, awareness of a living being around the child will always precede the eye contact. So when you want to define autism, we always say that first core symptom, that child has significant deficit in awareness of the living being, significant deficit in the awareness of the environment, significant deficit in the awareness of the situation around them. Only when the child develops awareness of the situation around them, child will be ready for eye contact. Apart from eye contact, once the child has eye contact, there will be further expression, that there will be a form of forming a non-verbal communication, which may be in the form of facial expressions, it may be in the form of behavioral, it may be in the form of affection, it may be in the form of expressing by pointing, or it may be also in the form of imitations, or maybe getting attention from the peers. Only when we develop this non-verbal communication, the child can have further interest into the social person, further interest into the living beings, in the form of developing relationship with the self, understanding his own body parts, trying to understand himself, trying to talk with himself, trying to understand with the family members, trying to interact with the family members, relatives, neighbors, therapists, doctors, peers, everyone will come into that. So same way, what we try to understand, that social communication deficit is a prime factor or prime concept in understanding autism. It is must for every autism to have a social communication deficit to call it as autism. And when you have social communication deficit, first component which we call it as a A1, which is primarily deals with the lack of social awareness and lack of interest into the social environment. Second component, as I said, the primarily it will deal with the lack of non-verbal expression, which also includes the eye contact and also lack of verbal expression. And the third component is about once we develop awareness of the environment, once we develop expression of the non-verbal communication, this next step the child should have been developing is a understanding of the people, understanding of the relationship, and that's how they are deficient in understanding the relationship or the peer feelings appropriately. And now when the child has lack of awareness, lack of non-verbal and verbal communication, and lack of understanding, this child fits into a concept of social communication deficit. And only when to this social communication deficit the behavioral disorders or behavioral problems get added, the child gets a label of autism. If there are no behavioral or repetitive disorders or no obsessions or no sensory issues, otherwise the child will remain only as a social communication deficit. Now, social communication deficit, as I had already said, how to improve whatever is happened, what is not working. And what is not working is mainly the understanding of the environment, understanding of the non-verbal communication, and understanding of the relationship. And therapy and medicines do work in the same direction. So the question here is how we can bring them to come some activity of autism children, how much time required by them so they can behave normally. It all depends upon how early are you intervening, what is the severity or dependency level of the child, what is there any other reason explaining the similar symptoms, and it also depends upon how the child is responding to the environmental stimuli. And if we can generate some degree of awareness of this environment, if you can generate some degree of communication with the environment, if you can generate some degree of eye contact with the environment, or if you can generate some degree of social interest into the peers or into the people, we are already overcoming the first three core features of the autism. And this can sometimes be done in very crucial way with the help of expert advice and treatment. At times, I see parents waiting for 4 years, 5 years, misguided by some people saying that don't run for eye contact, don't run for understanding, just leave the child alone. This is not going to solve the situation. Remember, never try to leave the child alone on himself. Never ever try to leave the child playing with the non-living stuff all the time. Never ever leave the child playing with the mobile all the time, because all these things are taking the child away from living beings, and all these objects are taking the child away from social connections. This is extremely important for those children who are having significant affection of this social communication, and that's the reason why we stop all these things in a child, because unless we expose the child to a social environment with continuous interference with the child's activities, continuous interaction with the child through a human live person, the child is not able to learn the social aspect, social affection, social communication, and frequently this has to be done in an auditory way. So mobile is definitely going to cause more more lack of attention, more getting interest into the focus into this light which is come from without having any cognition. So when you need to stop it, we recommend that child should be having alternatives for that. So if you feel the child is liking something on the mobile, it's actually not, he is not liking it, he's just getting fascinated by the light of it, which is diverting him from becoming a auditory learner, and which is forcing him to get guided by only the vision, and that's how the child is getting more and more obsessed with it without getting any creativity or without getting any further learning into it. So when we talk about stopping the mobile, you talk about introducing a radio which will help the child learn something passively. Same way, when you are, as I told you, that when you are talking or when you are around the child, always use a running commentary which will also help him socialize, so that you are trying to give a significant auditory and social stimulus. And even occupational therapy works by the same way. Apart from doing sensory integration, the significant auditory and vocal stimulus of the therapist definitely makes an impact on the child, and this can definitely be boosted by some kind of treatments which your neurodevelopmental pediatrician will be able to add, so that within 1 to 2 months we may be able to get a significant degree of social interest into the child. Once you develop the first step of social awareness in a child, the next steps will be banking on this social awareness to build the higher level of the social interaction, social cognition, and social reciprocation. And that is definitely will be the next step. And for each new step, the child has to learn the first step, strengthen the first step, and have support for development of the new step. And every step and every stage of any social awareness and social learning, the child is going to require support in the form of therapy and medicines, because in the beginning, the child's brain, wherever is the damage and whatever is the damage in a case of autism child, we really need to bypass it, we really need to rectify it, so that we will be able to generate a significant social understanding into the child. If you do not if you fail to make any generate any social understanding, we end up with cognitive deficits, and that makes the child totally not so easy to comprehend, not so easy to learn, and thus the child starts become independent. The severity of autism is graded depending upon the independence or dependency nature of the child, and we clearly need to understand that a child who has poor understanding, poor socialization, poor communication is definitely likely to be a more dependent child, that is called as level 3. And those children who have some understanding, some communication, they will be less dependent, they will be level 2. And minimum dependency level, that significantly greater understanding communication will come in level 1. So this is how we grade the severity. So to reduce the severity of the level of the autism, it's very, very, very important that we generate some understanding, generate some cognition, generate some social affect into the child, and not taking years or decades to develop the same thing, because the brain is in plastic state. Our brain is easily responsive for developing reception, or the synapses is only early few years of the life. After the first 6-7 years, it becomes really tough job, because the parents also start losing the interest, child starts getting hyperactive, and the doctors need to play around with various medicines to a larger level, and the parents lose hopes, because the same thing which would have been taking probably a few months in the second year of life, it may take many years after the age of 5 to 6 years to get the similar level of development. But definitely nothing is hopeless situation. Definitely whenever we start, it's never too late, but at least we can do something whenever we start with something. Okay. Any of you have any questions? If you have not understood any lines, topics, concepts, please try to be free with that, so that I will be able to elaborate them further. And if you have any other understanding is issues regarding what I tried to say, maybe I am talking in the medical language, we will really should try to get more comfortable. If anybody wants to ask any questions in Hindi, feel free for the same thing. Those who want to send me a personal message, you can note down my WhatsApp number, which is you can find out in searching Google for my name, Dr. Santosh Kondekar, and you may find my WhatsApp number easily. I may be able to help you out in generating significant giving significant tips in day-to-day life of the autistic children, for parents to deal with them, so that they can have a better quality of life for the child and the family altogether. As I told you, to summarize, come out of the non-living world, make all those toys disappear and get into paper and crayon, so that you will end up into some creativity. Similarly, stop the mobile, start the radio. In fact, sometimes video call is a mode of communication or mode of therapy, by which the child will have compulsion to interact, and it will work better than having just letting the child with a mobile. Non-living objects will prevent the child from developing social recognition and social communication. Social communication is in 3 steps: social awareness, non-verbal communication, and